She won most talkative in high school, and she has been running her mouth ever since. Welcome to the Lisa Fisher Said podcast with your host, Lisa Fisher.
Okay, this podcast episode is probably the most important of your life if you are a human. I was going to say if you're a girl, but you even help the boys.
Right.
And we're talking about pelvic therapy. And the first thing I learned, because I'm a customer, and that's why I'm in my customer clothing today. I went and I did my workout. I didn't come to Arkansas Pelvic Health, but I go to the gym and I do the workout because, you know, you get sent home with the instructions.
Yes.
And there I am doing a penguin walk, which is so important. We'll talk about in a minute. But the first thing I learned the first week I was there, and it blew my mind, stop peeing all the time.
Yeah.
Wait, what? So our mothers told us, empty your bladder when you have the urge or right before, if you're going to, y'all are stopping for drinks. You don't have to pee, but go ahead and pee. Because my mother said, you're going to get a UTI.
Mm-hmm. Right.
Are those myths?
I mean, I think that the moms did that out of convenience. Like, you know, you don't want to stop the car on your way somewhere if they could just pee before they leave the house.
Yes.
But it can, you know, holding urine for a long time, of course, can cause a UTI, but not for a few hours.
Yeah.
You should be able to delay an urge for a bit of time.
Yeah. And I know as a mom of 3 kids, 4 and under, like it's hard when you're like, okay, let's go pee before we get in the car. And that's like, if we're in the car a long time, that's it. We call it a jick pee, like a just in case pee. Like sometimes they're acceptable.
I do the jick all the time.
Well, yeah, you got to stop the jick. Stop it.
So,
Stop the jick.
You know, the jick teaches your bladder that it can only hold a certain amount of fluid. So if you are peeing when you don't really need to go, it's just a convenience pee, a jick pee, then, and your bladder can hold 500 milliliters of water. That's a whole water bottle. Mm-hmm. And you're jicking when it's 100 milliliters, less than half full, then your bladder starts to sound the alarms that you have to pee when you don't have to. And so then you get these people that are like, I'm peeing all the time. I have the tiny bladder. My grandma had it too. When really it was just that you trained your bladder to go ahead and send me those alarms when I'm less than halfway full.
Okay. I always call it wasn't just in case, it's while we're up, while we're out, while I'm here. And I've done it so much. So 3 weeks ago was my first time to be a client at Arkansas Pelvic Health. And when Bree told me that and I fell over, I died just a moment there at your facility.
You've since been resurrected.
Since then, I have made my bladder, I've trained it, y'all. It can now go 3 and 4 hours.
Isn't it interesting how quickly
Yes.
you were able to switch it? You know that commercial they always like where the bladder's like carrying the human, or like those little memes? Because like it truly becomes like that, but it's such a simple educational fix that we can teach people so that you can not have to worry when you go somewhere like, oh my gosh, where's the bathroom? I'm going to have to go. Or like, you plan your life around where bathrooms are. Like, we're not going to do that anymore, people.
I always. So I'm not a coffee drinker, and I know that's a diuretic, but I do drink, you know, just some water in the morning. I don't drink like a whole cup like a lot of people because I kind of take my thyroid medicine and move on. So let's say hypothetically, in a Lisa Fisher day, I get up at 6, I empty my bladder, and I go downstairs and I take my thyroid medicine and maybe a few ounces of water. And then a lot of times I go work out then about 7:30. So automatically at 7:30, I emptied my bladder because I was going to work out. And then I would come home, let's say 8:30. And if I had a podcast interview, I would empty my bladder because I thought, well, I'm going to be on a podcast. Now I'm going at 6 and I'm doing all those things. And it's 10 o'clock before I truly feel like I have a full bladder. And when I go, it's like the horse at the horse races. I mean, it is a full on pee, and I'm giddy. I'm so proud of my bladder.
Yeah, because it learns to hold. But you should typically, if you're drinking a normal amount of fluids, be able to hold 2 to 3 hours. And so you have a little bit of a longer hold there, but your fluids are also really low at that stage in the morning. My stage of life, my fluids are very high in the morning because I'm like coffee, water, second coffee. And that water's in between water in between only because I'm pelvic floor PT and I know I'm not going to drink 2 coffees in a row without giving myself a little water.
Okay. Well, and that's probably the same philosophy you need when you drink alcohol or do other
Yeah, right.
things that
Yeah, we
are
call it the water sandwich. So like sandwiching
the water sandwich.
Yeah, because you water, bladder irritant water, we sandwich it. So that dilutes the concentration of your urine, because when we have bladder irritants, our urine becomes more concentrated, which is what gives us that urgency, that frequency, that leakage that will happen, because our bladder's like, oh, don't want that. Let's get it out.
It's very similar to like reflux. You know, you probably have people in your life that have like acid reflux. You know, they know if they eat tomatoes or whatever, they need to take a Tums. So the bladder can reflux, and that's not what I'm talking about here, but it's almost like that. It's like where your bladder's like, get this out of here. It's too acidic. And so we see urgency, frequency, leakage. So if you can almost give a Tums right to your bladder just by getting some more water in, you can hold more.
That is amazing. Now, what about at night? Let's talk about someone who's of childbearing years and then postmenopausal women. How much nocturnal polyuria how many times should we be getting up in the middle of the night before we're concerned?
Right. So 0 to 1 is what we would like, because we don't want you getting up. But obviously, if you're, we have those people who don't drink water at all during the day. And then we have people who like shove in their fluids at nighttime. So remember, like the bladder holds that 16-ounce mark of fluid. So if you're going to drink all of your fluids at night, you're going to expect to wake up more. But we would like it to be 0 to 1. That's considered in our normal range.
And postmenopausal 1 is pretty much the answer. But of course, fluids matter and other issues matter too. So if you have sleep apnea or you grind your teeth and you're not getting into that REM sleep, that antidiuretic hormone isn't producing. So your kidneys are processing like it's daytime. So you're going to be up more. So that is a measure that we measure on people. How much are you waking up? And then we start thinking about blood sugar, sleep apnea, fluids and irritants. Like it's much more than just what you put in affects what goes out.
Now, I'm a thyroid patient, and I'm a thyroid advocate. Truly, I am. It's what got me interested in health with my own hypothyroidism 20 years ago. And the doctor that trained me just really discipled me, took me under his wing, even said you ought to go to medical school. And I said, I'm not smart. I remember, I have a really good memory about thyroids. But the one thing he explained to me was the antidiuretic is also a part of the pituitary thyroid adrenal axis. The thyroid the thyroid is the gas pedal to the body, people. And so if your gas pedal's not working, nothing works. Right. And he said, because that was a symptom for me in the beginning of hypothyroidism, was nocturnal polyuria, getting up to go to the bathroom in the middle of the night and not having to pee a lot. Right. That was what bothered me. I said, it told me it was time. And he said, because your antidiuretic the signals are crossed and things aren't right. So I never realized that it's a broader scope. Estrogen and low estradiol have something to do with that. In fact, I know when I'm at the end of my pellet, because I do an estradiol bioidentical hormone replacement therapy, estradiol pellet, I know because sometimes I have to wake up in the middle of the night. And in fact, when I leave here in 45 minutes, I'm going to have my pellet. So I'll be singing again the Hallelujah chorus at about 8 this afternoon, 8 to 9. But it's just amazing how the body works together for all the communication.
Right. Yeah. So, pelvic floor therapy, oftentimes people are like, oh, so you just do Kegals. And we're like, absolutely not. There's a very extensive history, that goes into all of it. We look at the meds and everything you eat, everything you drink, because that can give you the bladder symptoms. So people get to us because they have a bladder problem, a bowel problem, or a sex problem, or maybe menstruation, like pain or something. But we never look at just those things because it's all working together. So it's physical therapy, but it's much more holistic than the traditional. It's not just bones, muscles, ligaments, joints. There's a lot that goes into it.
A lot.
Yeah, your hoo-hoo's involved. I never knew how much my hoo-hoo was really the core of this whole vessel.
Yes.
Because what you don't realize when you first go there, I mean, you get very intimate with your physical therapist there, because the first time she puts on rubber gloves and you don't bend over and cough, but you do the other. You're just about in stirrups. And tell me about that. Let's talk about walking through, because it was intimidating at first to make the call, but I'd interviewed a lady who said she had a vagician and she was
Yes.
postmenopausal.
Yes.
And she said everyone needs one. Everyone, she was saying postmenopausal, but I say really if you've birthed anything,
Right. Yeah. Or even if you haven't. Yeah.
That's right. Even if you haven't, but definitely if you're postmenopausal, even if you haven't birthed anything, you all were telling me that even your pelvic floor, I guess, that laxity involved.
Right.
So that first appointment, you are wondering, what are you doing? And are you going to look at, the fat on my stomach? Yeah. She looks at the fat on your stomach and everything, because I had Bree. She does almost like a vaginal exam, but explain what that is.
Yeah. So the first visit, we always tell people we're going to get to know you really, really well. And we're going to ask all kinds of questions.
Understatement of the year. But yeah, go ahead.
I often said, I'm like, we're going to be best friends real fast, and I'm going to be up in y'all business real quick.
Right.
So, but it's we want to have an extensive medical history from like, what was your birth history? Like, have you had any pregnancies? What's your diet like? Because every single piece of the puzzle helps us figure out a plan for you specifically. So talking to the patient for about 45 minutes to an hour, because sometimes we don't even get to the exam in the first visit, because we're so involved in like your medical history. So then if an exam does happen, a lot of times there's obviously no stirrups, there's no speculum. It's like one small glove finger. Yeah. And a lot of people
I was
like
teasing. I was being funny a minute ago, but yes, you're exactly right.
With real small finger. Yeah. And we can do an intravaginal exam because the pelvic floor is full of muscles, just like anywhere else in the body. And it's like ortho in a cave. We just have to really know where we're going, and we can help you by doing an internal and external exam.
So it's much slower than your typical gynecology exam.
Yeah, sure.
we take the time to get the history because we have the time. That's one really nice part of our job. And then we explain it on the pelvic model. Mm-hmm. I usually say something like, let me just orient you to the space we're looking at, and, every bone there, every muscle that I'm looking for, and then how I access that. And then I also try to link it back to them. I'll say, okay, so you told me you're feeling pain with intercourse and it feels like you're hitting a wall. That makes me wonder about this particular muscle because it usually gives that referral pattern. Mm-hmm. So I'm interested in that, and just try to link it so they know. And then I usually, and I think this is because I've been a patient myself, I'll do my exam with one finger and I show them externally what I'm doing with the other so they can connect their brain to their body. I'll, do the same turns so that they can say, yes, that's it, or that's not exactly it. It's the same place, but that feels sharp and normally it's dull, so that you start connecting, because that's a big part of it. We are not healing you. You're healing you, right? We're just kind of pushing you in the right direction of what needs to be done.
Yeah. But we're also looking outside the pelvis too. We're looking at your abdomen because everything here attaches here. Everything in your back attaches there. Your leg muscles attach to your pelvis. So we're looking at more than just this like awesome pelvis that we love. We're looking outside to zoom out and see like what is going on to help you.
Yeah, it's really fascinating. The other thing, so the pain during intercourse, I thought that was a postmenopausal condition. So that can be any time during your reproductive years even.
Yeah, anytime.
Yeah. Okay. Sometimes the first clue that you might have pain with intercourse is pain with any insertion, including like tampons. Yeah. So I've treated 14 and 15-year-old gals that started their period. They started trying to use a tampon and they can't get anything inside. And it's kind of the first sign of, oh, this might be an issue, so let's go ahead and fix it. And I love the parents that develop their relationship with their kiddos, where they're like, Mom, I tried the tampon and it's not working. I mean, I had a parent text me this week. She was like, hey, we tried tampons and it's not working. Can you give me some tips on how to help my daughter? So I did. And then I was like, and if you need anything else, let me know. Because we know that's just a clue of what might happen later. And there's so many clues like that in pelvic health where you're like, oh, this happened when you were 15. Of course, this would be, we would expect this.
Sure. So can you fix anatomy?
Yeah. So a lot of times the pain with intercourse is muscles, right? And so any other muscle that you have tight, your shoulders, your jaw, the back of, neck muscles, the same reason people go to a masseuse. We can fix those muscles. We can help them function optimally. If there's a hymen issue, well, that's surgery. That's not us.
Right.
but we can guide you and fix it if we can. And if not, tell you what specialist to go to.
Yeah.
And that's rare. We're talking about muscular is more common with
Yes.
probably the
Yes.
approach
Yes. Yeah.
because
Right.
as our human bodies and our wear and tear and evolutionarily, things have changed in the years.
Yes.
Right. Pain with
I-
intercourse, though, is surprisingly super, super common. And it's unfortunate, but like we're trying to get the word out that like, hey, you don't have to suffer with that. Like
Yeah.
there is help because it's a lot of times, like Bethany said, it's a muscular dysfunction.
It's
That's
like
really
3 in
interesting.
4 women.
Mm-hmm.
Is that right? Well,
Yes, at some point in their lifetime, like even if it's like from the first time all the way like postmenopausal, at some
Yeah.
point, 3 in 4 women will have pain with intercourse.
well, I've had a million pains in my life. That's one I haven't had, but
That's
it could change in a minute. But now that I'm doing a penguin walk everywhere I go, because that's one of the things.
Aren't you glad I taught Brienne that exercise?
Yes, I am. And I love her, by the way.
She's
She is
fantastic.
just a doll. Now, I have noticed there's an MAN at your facility. Does he
Ooh.
do all the exams and all with people?
No, that MAN is married to Bethany, and he is a PT.
Okay.
And so he does all the other things. He wants
Okay.
nothing to do with what we
So
do.
when you were saying work wife a second ago, I was like, Stephen is my actual husband, so I'm his actual wife, but Beth Anne is his work wife.
100%.
So people know, pull the curtain back. Before we started recording, Darren, he is my work wife and everything, and he's married to a man, so he's not interested in me.
That.
So that's the continuation of that conversation because I was saying how much he does for me. So
Right.
Darren, sorry for the shout out as we're talking about vaginas. Sorry about that.
We treat the penises too, though. Don't worry about it.
Well, let's talk about that because I do another podcast with my interior stylist, Larry West. And I was telling him one day about I met a vagician and he said, does that mean you had a vagusment? And he goes, and then he said, just a minute. So I told him, I said, I think boys benefit from pelvic floor therapy too. So tell me about
They
that.
have the same muscle. So they have a pelvis, and also kids. Every single body has a pelvis. And so every single body has a pelvic floor. And so that's why we treat everyone.
And men's symptoms sometimes sound like inability to get their urine to start, or penile pain, testicular pain, pain in their anus. So sometimes it sounds different. It's not like, oh, I peed when I sneezed. It absolutely could happen. But typically it's like my testicle hurts or something like that.
Or they've had a prostate removal from like cancerous cells.
Yeah.
And that surrounds the urethra. And when we take that out, they're more likely to have leakage. The thing that's interesting about men is that what we always joke about is like women will deal with something for 25 years before they show up in our office. A man may cough and pee or have some kind of leakage or some kind of pain. And within 10 minutes, they're like, excuse me, I need an appointment. They're not going to suffer at all.
They have no idea what we endured our entire life. Everything hurts when you're pregnant.
Right.
Everything hurts after you've had a baby. So, and you lose all your modesty. So after, I would say childbirth is the most telling introspection into your mirror, into your own life. And so after that, I think women do just think it's just part of it. It just hurts.
That's also what we've been trained to know, for like, if you think people like of our mom's generation. So like my mom is 61.
Easy now.
No, I'm not calling you old, Lisa. I'm just saying my mom, 61. So like
your mom and I are locking arms.
So our parents' age, like this is not something that was talked about.
Yeah.
Like my grandma had never heard of anything. She's like, oh, I mean, we just wore pads. Like
your grandma didn't know she had a clitoris, I bet. I mean, she didn't know what any part was.
I don't know
nothing.
If she did. I'm not going to ask her
Please
either.
ask
Like, I'm going to call my grandma. Hey, Sylvia.
So I think that we just didn't talk about it, combined with just the Southern hospitality of being a woman, right?
100%.
Like, oh, I'm not hungry. You go ahead and eat this, or making sure you take care of everyone else, putting yourself on the back burner. So you combine this. We don't talk about that. Plus, I'm sure I can deal with it. I'm going to make sure everyone else is taken care of. Leads to this generation of people that they actually think that it's normal, not even just like,
Right.
oh, that happens to some people, but like, oh, I'll reach the day where I'll pee when I sneeze and I'll have pain with sex. Like all this stuff is so common. We're just accepting it as normal. And so we're out here on social media trying to be like, no, you don't have to.
Good.
And did I believe ever I'd be talking about vaginas on the internet? No. But here I am.
Did I think I would post videos about the clitoris? No, but I do quite often.
Now tell me, your story is, did you like bump into each other at PT school and you both had similar names? You said, let's have a business?
So,
No, it's a great story, actually.
The MAN at our clinic.
Yes.
So we've been dating since high school, and
Not we, her and
Yeah,
Steve.
right.
Yeah,
That we. Right.
We're dating since high school, and Beth Anne, Steven, and I all ended up in the same class in college in one of our exercise physiology classes. And
You
Steven
and your high school boyfriend had the same major?
Well, he played college basketball and he wanted to do athletic training.
Oh, okay.
And
That's
you can't,
unusual though. Yeah.
right. You can't like do athletic training and your collegiate sport. And so he
Right.
was like the next closest thing, physical therapy. So
That's
yes, but he put his backpack on and it knocked Beth Ann's coffee over onto her white blouse. And he just left
He
the
left.
room.
He left. And
Because
Bethany
he's
was
an MAN.
right.
Yes. He was just
Completely oblivious.
And I
Completely
was so
oblivious.
embarrassed. And I was like, I am so sorry. Can I get your shirt dry cleaned for you?
Because it was like, you know, in the day, like it was what, 15 years ago at this point? Like it was like a white button down polo.
Yes,
was
girl, I know.
Oh, I was like, this is ruined forever. And it was,
anyway,
which is fine.
I think the apologies and the offer to make it better struck up a friendship.
So we have been friends since 2007 because we were in the same class, and then we went to PT school together, and we're in the same study group because I learned very early on that Bethany is a lot smarter than I am, and I was like, I'm going to study with her.
That was good.
And so it ended up being us and Steven and another girl as a study group, and so like they helped me pass PT school. Thank you.
And we thank you. Girl, I've been hitching my wagon to smart people and all, you know,
Listen,
the
we
Darrens of the world all my life.
We have different strengths, and I'm like,
Yeah.
academia, babe, like. So I'm like, make friends with a smart person. And so we went through PT school together, and then we worked at the same place. And then I wanted to start a business for a long time, and she was like, no. And then she was like, I want to. And then I was like, no. And then finally we were like, we're doing this. And so we did. And
Then COVID.
And then COVID. We opened the week before COVID shut down. But we were thriving through COVID. And so we were just like, you know what? This is what we're going to do. And we're going to just put everything we have into it. And that's how we started.
Were you at UCA and Conway for PT school?
We were at Harding. We were the first
Harding.
class in their PT program at Harding.
Is that right? That's
We were.
awesome. Harding's a great school. Were you undergrad at Harding too?
Yes.
Yes.
So your parents, are bankrupt now.
Okay, my parents didn't pay for my school, and I'm not going to shame them for that, but I'm going to try
It
to
taught you something.
Not tell them. I'm not going to tell them I'm paying for
Yeah.
it because the people that I know that ended up dropping out or whatever, the common denominator was always their parents paid for their school. But I think I knew I had it on the line. So I do want to pay for my kids' school because I do have a lot of student loans, and I don't like that. But whatever, I'm living the dream. I'll pay my bills as they come in. But I want to try to pay for my kids' school.
Well, the Lisa and Chris Fisher School of Asshole Parenting includes when they lose their scholarship at, let's say, a big university where someone was an engineering major because he had a lot of fun.
Yeah.
What we said was, well, look, if you pay your way, but if you make the 3-point or above, like you were supposed to on the scholarship, we'll reimburse you.
Yeah.
Well, guess who didn't miss a study group? Guess who finished engineering school with a really good, when kids have skin in the game, it's amazing how all of a sudden that is the golden ticket.
100%.
Yes. So I do want to do something like that where there's skin in the game.
That's a great idea.
But,
It's incentivizing them. This is another conversation, but we're all best friends. We have contracts with all of our kids as they reach adulthood where they're having autonomy to drive a car. It's my car still. I'm paying the insurance. I'm paying the phone. So that's my phone. I can get the keys from that car because it's my car anytime, because that's part of the contract is when you work for somebody, they're like working for us, you know, if you look at it that way. And then when they went to college, if you violate the contract, then all the money dries up. just like we should be doing with our lawmakers and people spending
Right,
money.
right.
You know?
Yes.
So when I run for office, you know what it's based on? Contracts, parental contracts. Okay, let's move on to here's another thing. When I tell people I'm going to the vagician, they go, I'm doing my Kegals. And I went, not,
Please stop.
Yes, thank you.
Please stop.
help with that.
Okay, so Arnold Kegel, we are thankful for him for like just realizing, oh, there's muscles here. And it does make sense that people Kegel if anything's weak, if your arms are weak, anything, you're like, I'm going to go work out. I'm going to get stronger. So in the pelvic world, if you're like, oh, I'm leaking,
Yep.
maybe that's weakness, I'm going to go ahead and do my exercises.
Yep.
But what we know is the pelvic floor doesn't actually work automatically, or it doesn't work. It works automatically, I should say that. It's like blinking your eyes. They automatically blink when you need to. Sometimes there are times where like, I'm going to go ahead and help them blink. Maybe a bug's flying toward it. But the pelvic floor works automatically. So forcing it to work isn't very functional. Additionally, it can lead to pain. If your pelvic floor is already contracted, since it can hold stress there, sometimes people just hold their muscles there. Doing Kegels is actually going to contribute to pain. So we just threw out the Kegels, in our opinion, with the bathwater. There's very small amounts of times where we recommend Kegels, like very, very few, but mostly we just throw them out.
Then the main complaint what brings people, all the girls to the yard? Is it peeing, the urination, the trickle after they cough, sneeze, get on a trampoline?
I think it's a good mix, an unfortunate mix of incontinence, obviously, like peeing, when you cough, sneeze, laugh, urinary urgency, frequency, anything with urine. We've got people with constipation, but I would say pain with sex is a huge component of our practice.
All right.
Just pelvic pain in general. I feel like, what we do is pretty specialized. And I think it takes a lot for a patient to say, hey, I have an issue with this. Because number one, they might not even realize it's an issue.
Right.
So then they go to their yearly exam and the doctor's like, hey, just checking in. How's everything going? And they're like, good. And they just get their pap and move on, right? So they didn't tell their doctor, but it's because they didn't know it was an issue. The doctor didn't ask because they said, how's everything going? And they're like, good. And then maybe it does slowly start to come out. And sometimes people don't know that there's an option. And other times it gets swept under the rug. Like, oh, you're part of being a woman.
Yeah.
So sometimes we have these people that come in with just pelvic pain in general for years and years and years. And they've tried all these, different treatments, but never pelvic floor PT.
I would also say low back pain and hip pain are a huge issue. That the pelvic floor is one of the main causes of those.
So what is out of whack then if you're having low back pain and those kind of issues?
Yeah, right. Isn't that interesting? So the pelvic floor could be in spasm. So the muscles could just be so tight. Then that refers to different areas of your body.
Right.
The pelvic floor could be weak, making it harder. Because if you think of your pelvic floor at the bottom, when we're standing, all of the pressure it's holding up our body weight. And so if something's going off or something's like an alarm's going off, it's going to probably refer to your back or your hip. But those muscles attribute to the low back and hip all the time.
So it's like the foundation of your spine. Like the pelvic floor actually attaches to the coccyx, the tailbone, which is the very, bottom of the spine. So oftentimes we get people that have failed PT, many times for low back pain, and they end up with us because of leakage or something, and we're able to fix that back pain too. And they're like, well, this was an added bonus.
Yeah.
Really, if anyone's running for office, it's going to be y'all.
Better watch out. You never know.
About women would probably be fine.
Yeah, it's what will we call the campaign? Women for undercarriages. We can help your undercarriage, and guys will think it's about cars, so they'll vote for you.
Yes.
Women will know differently. I think that's one of the things as we age, we just think it's part of it, but somebody in the room here, me, had to start getting a little light day pad in my underwear. Yeah. Because I was noticing, I was going, this is ridiculous. Yeah. So do you get leakage even if, I do laugh a lot. I'm not a big cougher. So do you think I'm laughing through the day and it was trickling, or just life you can sometimes still leak?
Yeah, I mean, bending, even something like bending over, you get pressure from your abdomen that goes down into your pelvis, and that can cause some leakage. Lifting anything, if
That's a
something,
shocker. That's a
yeah,
shocker. And so Bree told me, because when you go through the evaluation, she said, well, I confess that a few years ago I had tripped. This was like 3 years ago. This is the first time I noticed it. I had tripped. And when I did, I kind of TT'd on myself.
yeah. I
And
also love that you said I confessed.
I know, right?
Like you sinned.
Right. Well, I mean, it's not something you really talk about in social media.
Right.
You talk about a
Right.
good hair day, or a surprise
Yes.
party, not
Yeah.
that you. And she
That you
said,
need
"Oh,
it.
she said that happened." And so I Googled it, of course, and I saw where other women said they had fallen and they had, like, you feel like you peed yourself, but it wasn't my whole bladder. So what's going on there between brain and pelvic area?
Okay, I think sometimes there's so many things. For one thing, when you're saying I had to start wearing a light pad,
Yeah.
I'm like, well, we used to think it was age and maybe tissue like
Yeah.
pliability. So we're like, estrogen will help. And it does, as we know, you're about to get your pellet. So, there's some new studies about your hip rotation affecting, it changes in age and it affects
Wow.
the pelvic health. And so, when, like you were saying, it started happening to me, we have teenagers that leak. Like, it's more than 80%. It was somewhere like 87% of female athletes have incontinence.
Is that right? Y'all,
So,
it's a wonder they still go out there and hustle.
Yeah, well, I
Right.
treated a softball pitcher because every time she went around and leaped, she peed on herself.
Yeah, one of my college girls, she chose Harding because they wore black spandex. She knew she couldn't go to a school that didn't wear black spandex.
Yeah.
So
I love her.
I know it's all ages, but
Oh, that's
the
interesting.
fall thing, I think that could be a pressure management, a kind of a panic. I'm holding my breath, and you land.
Yes,
It could also be a stress thing.
Also,
like, do you have a dog, or have you been around a dog when they're panicked and they just like pee on the floor?
Yes, so annoying.
Yeah.
Yes.
So, like, did you feel like you were maybe kind of panicked when you were falling? Like, sometimes it's like, I'm just out here to save my life.
Yeah,
And
I went down a few stairs.
Oh,
and when I landed, and it wasn't much, it wasn't landed. More that's hurt is your pride and the fact that like, I just peed.
Yeah.
So I didn't know. I just thought I had some type, I go from it's nothing to the worst disease there is, like
Same.
rather quickly. Yeah.
Same.
I've got the internet. Yeah. And I Google things. Yeah.
Me,
I'm going to stay over here.
Thank you. And then the other thing I noticed was, because I'm telling my bladder, who's at boss here, I had gone to lunch. I didn't go to the bathroom afterwards like I always did, because I'd always jick.
Yes.
Leaving the restaurant, even though I'd been there an hour. I'd still just go pee. So I held it. We were out at Sullivan's. Then I had to run an errand. Then I went to Costco, and there are big cases to pick up of water.
Yep.
And when I was in a certain bend, I did that. I felt like, I got a little TT. And she said, Bree was saying it was also because my bladder was pretty full at that point.
Mm-hmm.
So does that mean the muscles, do they just relax?
It kind of depends. It's really hard to know like all of these things without like assessing, but we can give you like a couple of scenarios. Like either it was so full and you just bent at the right angle that it like kicked your urethra and it was just like boom, or it was
super full. Then when people lift up heavy things, sometimes they hold their breath, which puts a little extra pressure down.
Yep.
So if you have a full bladder and you're holding your breath and you're kind of doing this, over the basket,
extra strain.
It's just the pressure. Yeah. It was like the perfect storm.
Yeah.
So breathing is real important at that point.
Yes.
Picking it up, breathing.
Yep.
Breathing.
Right. So this, if you think about it, you do already know that. People like, if men are holding their breath lifting something heavy, we usually see hernias.
Mm-hmm.
You'll see power lifters or athletes or whatever. They end up getting a hernia. Well, women have an extra orifice, an extra opening. Yep. So their pressure doesn't need to go to the little inguinal, canal where people get hernias. It goes through the vagina.
Yep.
And so people start to leak or get prolapse or something like that.
I didn't know why they were in the gym, why the breathing thing was so important, but now I can kind of see.
Yeah.
Oh, yeah.
this is the other thing that has really surprised me. And if we can, now we are on camera here, and some of you do watch on YouTube. I'm a YouTube sensation with like 50 downloads on these podcasts.
It's about to be more.
I know. I had Pioneer Woman and I had a bunch of downloads on that one. But with this, I don't know if one of you could even show us, but then you'd be out of the screen. But what are some basic things? The other thing Bree taught me was, as we age, balance is very, very important, and we lose balance. And I said, why is that? Because, I do work out, I do eat healthy, all those things. She said, doesn't matter. The sensations on your feet start to dissipate. Your equilibrium is off. Things that you take for granted. And that's why your grandmother fell. She said, that's why old people fall, go into the bathroom in the middle of the night, because they may not even be able to put their leg over something on the floor because of they get disoriented and some other things. So what are some things anyone listening right now that would benefit all ages, but especially those over 45 or 50? What are some things you think are really important to keep our core strength good? Now, one thing you all are having me do, it sounds so silly, but to stand by a chair on one leg. You're like, well, can everyone do that? Well, go try it, Miss Know-It-Alls.
Right.
So during worship last week, I stood on one leg and praised the Lord, and I stood on the other leg.
That's making it even harder. We love that.
I was practicing.
Yeah, a lot of single leg. I think what a lot of people don't do in their workouts are single leg exercises, which will actually make your double leg things better.
Wow.
So like a single leg stance or standing on one leg will actually make your squat better, because your glutes, you're training both sides. Not as much compensation.
So I would also say we bring balance into pelvic health therapy, because when the pelvic floor is working, the core is working. So core is part of your balance system. We can't fix the sensation on your feet. We can't fix the equilibrium in your ears, but we can fix your core and pelvic floor, which contributes to balance. Something else we do is just get our people lifting weights.
Yes.
It's Wolf's Law, stronger muscles, stronger bones. So if you did fall, hopefully we're not breaking anything.
Yeah.
So we're working on core and pelvic floor. We're working on balance, because that's also holistic. Even though you came for one particular thing, you're a whole human. Like I don't want to see you in a year seeing Steven, the MAN at our clinic.
The MAN,
right. So, some of that too, but some of the exercises, I would say the single leg, I love that. As long as you're close to something to hold on, and anything butt and hips and weight. So the penguin walks you're talking about with the band around your feet, or some people can do it on their knees. And I like to add a band above the head. So you're doing the same exercise. You have a band low and high, because then you kind of get some double duty, and you're getting your core, because you have resistance above, and
you're kind of squatting. You're kind of lower. Right, so anyone listening, you put
the side.
Step to the side.
Like if you have those bands on, around your knee, and then one above your head, and you're just walking sideways, and it's getting your hips, your core. I don't always give people the above the head immediately, because that takes out part of your safety mechanism. If I haven't worked with you personally, and I don't trust that you can walk with your hands attached, then we don't give that for home. So we're like, what's safe? Even standing up and sitting down out of a chair, kind of like a squat. I mean, that I always start my
functional
up and down.
It's so functional, because how many times do we stand up and sit down every single day?
Off the toilet? You're never going to have a lift toilet. Out of a car?
Out of your recliner? Like off the couch? Anywhere.
And so we do that with one leg extended. And that's one thing.
And then you can add in that when your balance is a little bit bigger. Or better, not bigger. Sorry.
Yeah. So that those are important things. Another thing, because I'm sure it was illegal today when I was at the Little Rock Athletic Club showing this woman who's pregnant with her 5th child. This is what they taught me at Arkansas Pelvic Health. Because she's going to come see you after the 5th one comes. Like she said, I'll text you in a few months.
Now, before her 5th one comes.
Oh, wait. Should she come even before the baby's born?
Yeah, 100%. We love treating pregnancy, because you shouldn't have back pain or hip pain in pregnancy. But I am
texting her. When we hang up, I'm texting her, because she thought it was after she's 30. She's 32 weeks since her 5th child. But I was showing her something else. I said, well, the other thing they have me do is just standing here, but pulling one band down. So is that because it's giving me core
That's core. Yeah.
strength? Okay. The
Yeah.
little things we take for granted, not realizing that it benefits all of it.
Right. So most of our exercises, because we know we have you a very short segment of your entire day and then week and then month and then life, is every exercise we give usually targets multiple things for multiple reasons. Because like the mom of about to be 5, you can't give her an hour homework to do. No. She's not going to have time. But can I give her 2 things and that targets, 15? Yes.
Okay, I'm totally going to text her. I would say her name, but HIPAA. I don't want to. I act like she's mine. But okay. The other thing you all say, so I started following you for some reason, and I got so tickled because you said we're the place that we talk about pee and poop and sex.
But just in
which
case
I thought was so
saying,
cute because they're all
something else
part
during
of
pregnancy that we do is perineal stretching, which statistically, in research shows that it decreases the risk of tearing during vaginal deliveries.
And it helps the second stage of labor. So you have a much better labor process and then a faster recovery because you did pelvic floor going into your delivery.
Now we're going to turn our attention to poop. And this is like, if you had a 5-year-old or a 10-year-old boy, they would think this is so funny. But this isn't funny. So the pelvic floor, I guess, has so much control on how it holds both if your colon is full, or by then it's past the colon. What's if the bladder has urine at that point? What's holding the poo? The rectum. Okay.
Mm-hmm. And it sits on the floor of the pelvis. That's why we talk about pee, poop, and sex all day. It's in our cave. It's in our cave.
People think this is TMI, and I'm like, probably not.
Probably not. We heard it before. We straight up have. But your poop tells you so much about your body. Like, there's this thing called the Bristol stool scale, and it has 7 types of poop and a picture of what they look like. And I show it to all of my clients of like, what is your most common type of bowel movement that you have? Because that's going to tell me a lot about your diet, all the things.
Dr. Oz did that years ago. And I remember like that was the thing. And so as a mother, I would say to my kids, because we're thyroid patients, which is constipation, which means you have O's. And remember, he would say, no O's.
We want
no
snakes.
O's.
We want snakes.
Yeah, right. And so I would always, and my kids still will grow up and go, Mom, please just don't ask if we have O's. Because I'll kind of want to know what their thyroid's doing. Yeah. Please don't ask out loud if we have O's. But we don't want O's, so we don't want constipation.
Right.
And then what's the prettiest poop we want? What does it look like?
I tell my toddlers, I'm like, we don't want blueberries. We want bananas. We want smooth. Okay. We want smooth. And it can be slightly lumpy, but like a long piece of stool that's either smooth or slightly lumpy. That's what we're looking for.
We should have had a disclaimer that if this is during your lunch hour,
please do not listen.
Don't listen.
Trigger warning.
Right. But as an intermittent faster, I hope you're not eating till later today anyway. So you may be okay. Never thought that poop would mean something, but poop means something because of the control. And the other thing I told Bree was I noticed that my bladder holds more if my bowels are empty.
Yes.
So, yeah.
So like kiddos, if they're peeing a ton and you're like, dude, I deal with this with my 6-year-old a lot because he doesn't want to stop playing with his Hot Wheels to use the bathroom, but he'll have to pee like 3 times in 2 hours. And I'm like, boy, go sit on the toilet. And he's like, I don't need to poop. And I'm like, your clues say otherwise. And so he'll go and sit on the toilet and poop. And the kids that are like peeing a lot in their sleep still, especially past age 7, usually they're constipated. Yep. Their bladder won't hold because their bowels are full.
Okay. Now, and we have to have the conversation. You need to be emptying your bowels every day.
Every day to every other day is what we like. Every other day is considered still normal. So we don't want to be like, you have to poop every single day because that puts a lot of pressure on people. But the bowels really like a routine. They want to go at the same time, at the same place. They like the same toilet most of the time, but every single day or every other day.
So when you're traveling then and you have a car ride, you go ahead and do that one big bladder empty, but then do you refrain from liquids in the car like most of us because you don't want your husband, my husband's a camel, he pees on Mondays and Fridays. Like, how do y'all do it?
So I would say if you're traveling, constipation's a real thing. We call it vacation constipation.
Mm-hmm. Oh,
and
for
usually
sure.
it's because your activity is different and what you're eating and drinking is different. So I encourage people to go ahead and still be drinking in the car just like they normally would. And okay, if you're holding normal amounts, that's only stopping at once every 2 to 3 hours. Like that's still a long stretch of time. Mm-hmm. So if a lot of people start to withhold because they're going to have to stop all the time, well, that's probably because you're withholding, right? We already discussed more water is helpful for that longer holding. So yeah, I still drink normally and same. Yeah. On
then
trips. Oh yeah.
I even told Bree that now, because I think I really am trying to stretch 3 to 4 hours, and it was about 9 o'clock, and I really had to empty my bladder because I hadn't peed since 6, and I had liquids probably with my meal, and then I go to bed at 10. And I was going, do I or don't I? And
she said, bed. Yeah, that's one of the acceptable times of jicking. Like, if you're going to go before, like on a long car trip or something, like jick before and then get in the car. And like one time before bed, but don't go like 3 to 4 times before bed. That's going to create some really poor habits.
And not every time you leave the house. Save it for the appropriate times. Jick if you're going on a really long car ride. Jick before bed. And I say the same thing about hovering over the toilet. Sit your butt down on the toilet every time you use it, unless you're in a porta potty at Mardi Gras. Hover. Do not sit on that.
I still sit on it because your skin is a great barrier. And I know Bethany's a total germaphobe, and I just am not.
You have to save it for the appropriate times.
But no, if you do that, you're not going to empty your bladder as well as you normally would if you sit down.
When you're ooched up, you can't get to a position where you can really...
You cannot fully relax the pelvic floor muscles when you are at an incline. No.
Well, then that brings up the squatty potty, because I bought one a few years ago.
We love the squatty potty.
But then I was so I was so embarrassed to have to pull it out and then put it back in. I don't want my husband to know I poop.
What? Let me tell you a secret, though. I bought it for our house, and I caught my husband finally using it after so long. I was like, I promise, Chris Travis, you would poop so much better if you just put your feet on this stool. He's like, no. But I'll tell you this, I got my brother one for Christmas, and I'm gonna tell you, he called me the day after and was like, that was the best poop I've ever taken in my life. I said, you're welcome.
So does he pull it? Does he like hide it someplace else? Because they're bulky.
It's the gift, man. You just push it under your toilet. They make pretty ones. They make pretty ones.
Mine was a big one.
They make really pretty ones, and they tuck up under the toilet too. But here's the thing. If you're not peeing and pooping, you're literally dead.
Yeah.
So let your husband enjoy you being alive. Come on, he knows you pee and poop.
I would say 35 years of marriage, there are no secrets.
100% he knows that you're going to poop, and it's okay.
We got it. It's just that thing was so bulky. It's at the Goodwill on Highway 10 if anyone wants it. Because it was just so...
Get yourself a pretty...
I'm going to get a smaller one because truly we want our stance so that our knees are closer to our chest and our hips are in a certain level or position.
Our knees slightly above our hips so that colon angle can be just like, it should just fall out of you with breathing.
I mean, let's talk about dogs when they poop, how they ooch down.
Well, and about toddlers who crouch down. Like that's how our bodies are meant to poop.
And our toilets here in the U.S. are usually high. Yeah. So you don't have to stand. It's not as hard to stand up, but in Europe, in other countries, they're low, even really low, or just like a hole. And we have more constipation than any other country. Now, it could be some food. We're going to acknowledge that. I agree. But it also could be the mechanical issues. Yeah. So knees above hips with your feet still supported, like holding them up, a 2-minute muscle contraction.
Wait, even if you're on your tiptoes, just relax your feet because if you're on your tiptoes, your pelvic floor is still slightly contracted.
Okay, so not head and shoulders, knees and toes, but it's knees above your butt and hips, and hips. Knees above your
Yes, slightly lean forward.
Right. And okay.
Unless you ever have to lean back.
Unless you have what?
Erectocele. It's
a form of a prolapse, but it's the back side of the vagina. And those people are going to poop better leaning backwards.
Yep.
Okay, now I have a friend who had 10 pregnancies, and that 10th one, like all of it almost came out. Like her rectum prolapsed.
Oh, yeah.
Super common.
So Mrs. Duggar, we know what you're dealing with. I mean, and that was pregnant. This girl had 9 and 10 pound baby pregnancies.
Right. And it's just the genetic cards you're dealt with. Right. Some people can have a ton of kids and literally 0 pelvic floor issues. And some people can have no kids and all the pelvic floor issues. Like, there's no predicting it. All you can do is set yourself up for success the best way possible and deal with your genetic cards as they come. You know, fix what you can as you need it. But yeah, people can have prolapse after 1 kid. People can have prolapse without any children at all. So
Yeah. I thought it was multiple pregnancies, so I didn't know. Yeah. Now, the other benefit about having a relationship with y'all is you take my health insurance. So health insurance does cover, and Bree said that I have 12 visits, but I might graduate earlier if I'm doing better. So
look at you, complying in the home program.
Is 12 about what you think of when people come?
It kind of varies. I mean, I think it also varies on like each person individually. Like some people have like 4 visits, some people have 6, some people will treat people for years. You know, some people have long lasting conditions that will need therapy forever. But it's independent on your case. Yeah. The layers of things that you have going on. Sometimes people come in and they're like, oh, I just have this. Mm-hmm. We're like, okay, we get that better. And they're like, oh, but my back's hurting now. And it's because we finally got their pelvic floor to relax to its proper position. We realize their back is actually unstable. Right. We got to do some back exercises now. So there's like just layers that happen. But I would say traditionally, my patients that are just like, you know, they've been dealing with the same problem, 5 to 10 visits, and they're being like, girlie, do I even need you anymore? But I do have probably 10 or so patients that are kind of lifers. Mm-hmm. You know, they have many, many, many comorbidities, sucky genetic cards. Yeah. Even though they're doing everything they can, it's just like they need a little bit of extra help.
But shouldn't I will be doing these exercises then at home to keep my balance, to keep all the things, all the parts working. That's what I think is so important. Yeah, that's pelvic health. And that's also just balance and bone health and all of those things. So exercise in general is good. And she'll give you exercises, but there's no way she's going to say, if you don't do these, all this is coming back. Like, you might be fine. Yeah. Right. But we're just trying to set yourself up for success to be the best possible. Right. Okay. Well, tell that MAN hello. I've seen him there.
We will.
And he's nice, but I just was like, ooh, is he going to do the exam? So girls do the exam, and he does the fluffy
everything else.
And he's also taken the female athlete course.
Yeah, he's so good. We've worked with him, you know, forever. And so because of what we do, he is very knowledgeable in what we do because he is around us all the time. But you gotta consider him a trooper because he works with like 13 women. Like,
bless it.
He's
a good man. He's a good man. Well, I hope you do have boys then at home to dig in the dirt and get do all the things the boys do. So you said you have a son.
He gets it in.
Yeah, she has 2. Yeah, 2 boys.
And what do you have?
I have a boy and 2 girls.
Good. So we'll be doing this forever. I mean, you'll be talking about undercarriages until you die. So
right. But here's what we're doing different though. I'm teaching my daughter and my sons because they, 50% of the population has periods. Yeah. You know, I'm going to teach them about periods. They're going to have a partner and have sex. Probably, I'm going to let them know about all the ins and outs of those. Because I think part of some of the issues we have is just under education. And we could start how we are on this podcast and on social media and just being out there, but teaching our kids. Yeah. Right. Our accidental goal here is working ourselves out of a job. Like, if people can just have optimal health, public health, like I can find something else to do.
That's right. I'm sure we could just be running the circuit, just being cute together because y'all are adorable. Thank you so much for doing this, and let's tighten those undercarriages, people. Let's tighten those hoo-hoos.
Thanks for having us, Lisa.
Great job. Thanks for listening to the Lisa Fisher Said podcast. Be sure to hit subscribe and download all the episodes and leave a review, won't you? The Lisa Fisher Said podcast is produced by ClantonCreative.com.